my name is Rachel Covey, and I was in a group with McKenna Gorson and Sarah Vanderwerf, and we did our presentation on hypertension. So hypertension is when long-term force of blood against the artery walls is high enough that it can cause health problems. So a little bit about the causes of hypertension. There are two types, primary and secondary. Primary has no identifiable causes and usually develops gradually over the span of quite a few years. And then secondary is generally caused by underlying conditions, and it usually appears pretty suddenly and causes your blood pressure to be even higher than that if you would have primary hypertension. So some of those various conditions or medications that can cause secondary hypertension are sleep apnea, kidney disease, adrenal gland tumors, thyroid problems, certain blood vessel defects that you may have been born with, medications like birth control, cold remedies, over-the-counter pain medications, and decongestants and things like that, and then also illegal drugs. Some risk factors, age is a pretty big one because your risk increases as you age. And then also race, because this is more common among people of African heritage. And also your family history, because this condition does have some pretty strong genetic ties. And also being overweight or obese, because the more you weigh, the more blood you need to supply your tissues with oxygen and nutrients. And then as the amount of blood you need increases, so does the pressure that's going to be on your artery walls. And then also another risk factor is if you're not very physically active, or if you use tobacco, have too much salt in your diet, drink a lot of alcohol, or are a pretty high stress person. Some symptoms and assessments. Most people have no symptoms even if their blood pressure is dangerously high. And usually the only time that you're going to start experiencing symptoms is if your blood pressure is pretty dangerously high. So some examples of some symptoms you may experience if you're at that dangerously high level of blood pressure would be headaches, shortness of breath, and nosebleeds. So even without symptoms, high blood pressure can cause some pretty severe side effects and damage to blood vessels and organs like the brain, heart, eyes, and kidneys. So it's important to get your blood pressure checked regularly, since even if you're not showing symptoms, your blood pressure can be causing significant damage. So an assessment for this condition is as simple as a doctor or nurse taking your blood pressure. And if they assess that your blood pressure is pretty high, they're going to ask that you get your blood pressure taken regularly for a few days or weeks. And if that blood pressure remains high and doesn't regulate itself or go back down, the doctor will most likely conduct more tests to rule out any underlying conditions that could be leading to high blood pressure. Some examples of these tests would be a urine test, cholesterol screening, electrocardiogram or ECG, and an ultrasound of the kidneys and some other organs. And these tests are going to help identify any secondary issues that could be causing an elevated blood pressure, and also assess if high blood pressure has caused any damage to your organs already. Treatment for this condition really differs from person to person, and depending on the severity, high blood pressure can be treated with something as simple as just some lifestyle changes, but usually it requires a mixture of lifestyle changes as well as medications or a combination of medications. So some lifestyle changes that could be pretty beneficial include eating a healthy diet, increasing your physical activity, maintaining a healthy weight, managing stress, and adopting a cleaner lifestyle like stopping any alcohol consumption or smoking. There are also quite a few different medications that can be used to treat this condition, and usually they're used in combination with each other. The most common are beta blockers, which make the heart beat slower and with less force, diuretics, which help the kidney remove excess sodium from your body and keep excess fluids out, which can help lower your blood pressure, and then also ACE inhibitors, which prevent the body from producing a chemical that can cause vessel walls to tighten and narrow. So for prognosis and follow-up, with time, hypertension is usually treatable once you figure out what combination of lifestyle changes and medications are most effective for you. Especially as you age, it's very important to get regular blood pressure readings because, as I mentioned before, this condition doesn't have any symptoms. So even if you're not experiencing any of the symptoms, you could still be experiencing blood pressure that is high enough to cause very significant damage to your internal organs and stuff. So if it is left untreated, this condition can lead to heart attack or stroke, an aneurysm, heart failure, weakened and narrow blood vessels in your kidney and eyes, metabolic syndrome, trouble with memory or understanding, and dementia. So the earlier this is caught, the best and most successfully this condition can be treated. So if you have any questions, you can feel free to ask. Otherwise, if you need any more information, here are the sources that I used.